this session. So from a volume loss perspective, when we address these patients, there's different approaches. I wrote a few years ago my column in Skin and Aging, different approaches, but I think uniformly we agree, and Dr. Monheit talked this morning about his approach, that we go deep. We place filler below the level of the bone, below the level of the muscle onto the periosteum so that hopefully we can lift things up in that area and create a good contour without actually causing lumps and bumps in that area. And I think one thing that's helpful, whatever approach we have, is actually treat one side and then to actually hand the mirror over to the patient so that they can see the improvement on one side before you head over to the other side. Because we're not putting large quantities, as people alluded to. In many cases, we put a half a cc below each eye, and we can actually see the improvement of areas. So linear threading was the technique that I did in that area. There's other techniques that have been described, and people historically have just focused on these 4 techniques. And I think that there's a couple other things that we can add to this list. An anterior approach to the infraorbital area is something that Gerhard Sattler has spoken about in dermatologic surgery. There was a review article that was done with the Carruthers, as well as Gerhard Sattler and Bertolciani, looking at this really anterior approach and creating spicules of filler to really lift up the area. So by creating these little spicules here, not putting a large bolus in an area, but by just putting these spicules in, he really was able to show that you can get a nice improvement and you don't have to use lots and lots of quantity to these areas. I think as we approach any area, we need to understand the relevant vasculature in the area. And as we approach the whole infraorbital area, it's not just the infraorbital artery and medially the angular artery. We have to pay attention to the zygomatic facial and the zygomatic and temporal areas as we augment these areas. Because even with an anterior approach such as this, where I attempted to tunnel, I created this bruise and actually an attorney. So fortunately, there are things that we can do. This is a circumstance where I actually used a pulse dye laser, and we'll talk about the study in just a second. And the settings were 7.5 joules at 6 milliseconds with a 10 millimeter spot. And then I had her send me pictures the next day, and I took a lot of the target chromophore out of there. So I think that that's a helpful tip that we can implement into our offices, to use a light-based device to treat undesired bruising, because there are a lot of vessels in these areas. And that really approach comes from this article. Julie Caron, Liz Hale, and Roy Geronimus's group did this study looking at